Hi, everyone. It's 8:01, so let's get started. I just want to welcome everyone. We're so glad that you're here for tonight's webinar, which is hosted by JOMA. It's an organization dedicated to empowering our community with reliable, accessible, and culturally sensitive health information. This program tonight is brought to you by JOMA, Hamed, and Turo, and the webinar is in memory of Leah Basharab Tzvi. My name is Gabrielle Dayan. I'm a third-year medical student at New York Medical College, and we're grateful to have you joining us for this important conversation. Today, we're focusing on something that affects every one of us, heart health. Heart disease remains the number one cause of death for women, but the encouraging news is that there's so much of it is preventable with the right knowledge and small, realistic lifestyle changes. As Jewish women, many of us carry a tremendous physical and emotional load, caring for families, raising children, supporting aging parents, and keeping our homes running, especially around Shabbos and Yom Tov. Taking care of your own heart isn't selfish. It's essential to sustaining everything you do. We are honored to have two outstanding physicians with us, Dr. Rosanel and Dr. Orkaby. Hold on just one second. Sorry. I just lost something here. Okay, here we go. Dr. Sarah Rosanel is the founder and CEO of Dr. Rosanel MD, a premier concierge medical practice serving patients worldwide, including in the US, Canada, France, Dubai, and Israel. Born in Casablanca and raised in Paris, she moved to New York at 17 to attend Yeshiva University, graduating cum laude in biochemistry. She earned her MD with honors from the Technion Israel Institute of Technology, then completed her internal medicine residency and cardiology fellowship at Maimonides Medical Center. After serving as a cardiology attending at Memorial Regional Hospital, Dr. Rosanel launched her boutique practice to provide highly personalized care to high-profile patients. Recognized among cardiovascular businesses 40 under 40, she is also a featured doctor by Best in Florida magazine, a keynote speaker, and recipient of the Lifelong Physician Leader Award, a dedicated mentor and board member of leading medical and philanthropic organizations. She continues to shape the future of medicine and leadership. Dr. Ariela Orkaby, MD and PH, is a specialist in internal medicine, geriatrics, and preventive cardiology. She completed her training at Ben-Gurion University of the Negev, Boston University Medical Center, and Harvard-affiliated hospitals where she remains on staff. She is an associate professor of medicine at Harvard Medical School. Based in Boston, Dr. Orkaby is passionate about caring for older adults, facilitating their transition to elderhood, and navigating the complexities of medicine and life in later age. Her primary interest lies in cardiovascular disease prevention and promoting healthy longevity through research and clinical care. Dr. Orkaby views caring for our body as part of Avodas Hashem and considers it an honor to help others in this endeavor. She attributes her success to the love and support of her 4 children and her husband's unwavering encouragement. Our goal tonight is simple: to give you clear, down-to-earth information that you can use right away, without medical jargon, without fear, and without judgment. Please feel free to use the chat to submit questions at any time. We'll leave time at the end to answer as many as we can. Thank you again for joining us, and thank you to JOMA for bringing this educational event to the community. Let's get started. Okay, so the very first question that we have for our panelists is, what are the reasons that we should prioritize our heart health as Jewish women?
So first of
Dr.
all,
Rosanel, you could start us off.
Yeah,
thank
go
you
ahead.
so much for having us here today, and thank you for the beautiful introduction. Just so you know, Dr. Orkaby and I went to Stern together, so it's very, very special that we get to reconnect years and years later, and that's the beauty about JOMA as well. By the way, it's a Jewish physician. Being able to connect and stay together even throughout the year. So that's amazing. I'm so happy and excited to be here with Dr. Orkaby. But to answer your question, it's extremely important that from a young age, when I'm telling a young age, I really say even in your 20s and your 30s and on, to be aware about the heart disease that's in your family, because the genetic, we are the results of the gene pool from our father or mother, cousins, uncle, aunts, etc. And it's extremely important to be aware if there was any heart disease in the family, because that will influence your path. So that's the one thing that I want everybody to know is education. I have a lot more to say, but I'm going to let Dr. Orkaby.
Thank you, Dr. Rosanel. It's true. It's amazing to be back together all these years later. And thank you to JOMA for bringing us together for this conversation. I would say the reason we need to prioritize our health is because it's a mitzvah. And let's just start there. There are so many other psukim that we could go to, but this is our job. This is our tafkid. We have to take care of ourselves. When we take care of ourselves, we can take care of our children, our family members, our parents, our community. So that's why we're here. That's why we're here to talk about ourselves and how we can make sure that we can take the best care of our bodies.
Thank you for that. That definitely makes a lot of sense. And it's important that we're having this conversation tonight. And of course, both of you are noted cardiologists. So tell us, what are some common signs that something might be wrong with your heart, especially in women?
Yes, women can present very differently. And sometimes we're just feeling tired. We're feeling like we just don't have the strength or the energy to do things the way we're used to. When we think about heart disease or heart attacks, we might just think about a crushing pain in the chest. That's typically what many men might present with. And for women, it could be very different. Dr. Rosanel, what do you usually see in your practice?
So the first thing that's important to note for all of us women here listening, and hopefully more women will even look at the video, is to be aware that heart disease is not a man's disease. Okay, so heart disease is actually the number one killer worldwide, more than breast cancer, more than any cancer that you can imagine. And it does affect men and women equally. So back in the days, we used to say, with the cardiologist community, that, oh, the heart attack happens to someone who's like in the 40s, no, let's say in the 50s, 60s and up. You're typically an overweight man, typically somebody who will be smoking, not taking care of their health, and they will have a heart attack. And we will kind of blame it on them. We'll say, oh, it's his fault. He didn't take care of himself. He didn't eat properly. He didn't, he was smoking. He didn't see a doctor. But the truth is, that heart disease happen to both men and women. And I'm sure there's people in this room today who can witness that they've seen a loved one, a young person, just dropping dead from a heart attack. I mean, if you think about it, even if you think about athletes, it's very common that you can see young people, even men or women, just dropping dead on the basketball field. So important to know that it affects men and women, and it can affect at any age. So we're going to talk more tonight about what can we do? What are the signs? What is in our power today to make sure that we don't ignore the sign that Hashem is giving us? So every time someone is having a fever, right? So a fever is actually your body screaming, your body telling you something is happening, an infection, an inflammation. Well, this is the same idea when it comes to heart attack. So Dr. Orkaby mentioned fatigue. Absolutely true. Chest pain, absolutely true. But we also have abdominal pain. So it's interesting, like abdominal pain. Well, what do you mean with women? So of course we're going to have, whenever we have a period, we're going to have abdominal pain or something like that. But that's also something important to know in the context of someone who has a family history of heart disease. Someone who has, for example, high cholesterol. But how would you know you have high cholesterol unless you go to a doctor and you check those cholesterol? So many times I have patients who come to me and they say, oh, but I do blood tests every year, doctor, I'm fine. I'm like, okay, can I please see the blood test that you've done in the past? And when I look at the blood test, there is no A1C, which is a value, hemoglobin A1C, that tells me if the patient may or may not be diabetic or have a predisposition to be diabetic, which is a risk factor for heart disease. There is no cholesterol, right? So they've got blood tests. They've got blood tests every year, but no one checked the lipid profile. So very, very, very important. And we're going to speak about it tonight more, but like I said, affects everybody. And we're going to speak about the details about what to look for in a blood test, what to look for in the symptoms, and what to look for in general, knowing your history, your ancestry, who died from what. That's extremely important.
Thank you. Dr. Orkaby, anything you'd like to add?
Yeah, I think I would augment exactly what you're saying, Dr. Rosanel, is making sure that we're aware of our bodies. There are aches and pains that can come and go, things that might not feel right. If something doesn't feel right, don't just brush it off. I think that is probably, if you take nothing else away from tonight, it's that. It's get yourself a primary care doctor. And if something doesn't feel right, let them know, because it could be your heart. And if it's not your heart, maybe it's something else, but it could be your heart. And we don't want to miss that.
I love what you said. So essentially, Hashem is sending the signs and we just have to listen to them.
Exactly.
So we've all heard of heart attacks, and both of you have mentioned them just now. And like we always think of some sort of crushing or burning pain in the center of the chest, and maybe it happens to some man who's not taking care of his health. But what are some early warning signs that we might miss or ignore, and particularly in women?
Dr. Rosanel, why don't you go first here?
Yes. Okay. So you need to understand that a lot of the time with heart disease, it happens abruptly. So just so you know, half of the heart attack don't even make it to the hospital, and people die on the field before even reaching to a physician. So I'm huge into prevention and education and testing patients and the community, men and women, very, very early. So one thing that I mentioned is that there is this saying that we think heart attack happens in men. Therefore, whenever a woman patient will go to either the emergency room because she listened to this webinar, she said, "Oh, I'm having this symptom, let's say the stomach pain, a little bit of chest pain, I'm short of breath when I'm doing just little steps going to my mailbox," which is a huge warning sign. Okay, so shortness of breath on minimal exertion, that's a huge sign that something could be wrong. But she will go to the hospital, or she will even go to her primary care physician. And unfortunately, because of the stigma that for so many years we've been saying that heart attack happens to men, a woman would not even get an EKG. So what's an EKG? An EKG is simple. It's a bunch of electrodes placed everywhere, mostly in the chest, and they would not even get that test done, or they would not get the blood test that has troponin in it, which will tell me if somebody is having an acute heart attack right now as the patient is coming to me in a hospital setting, for example. So coming back to education, coming back into understanding what you need to communicate with your physician, whether it's a primary care physician, an ER physician, emergency room physician, or even going to see a cardiologist in a young age. It doesn't hurt, okay? It's important to go. I think everyone should go in their 20s, even once, and try to do some basic testing, such as like the cholesterol, the A1C. Sometimes there's even advanced testing that we have to do if somebody has a history of heart disease in the family. And that's where we have a baseline. We know who you are, what you are, and eventually warn you about the signs to look for, such as we want all of our patients to exercise at least 30 minutes a day of walking. If my patient is telling me, "Listen, doc, I'm walking, but after a couple of minutes, I'm short of breath." Okay, something is wrong. We need to investigate that and not brush it off again. So shortness of breath on exertion, sweating, profuse sweating. This is something that could be abnormal. I'm not talking about sweating at night when we're going to bed and we drench. I'm talking about sweating that I'm sitting down with a friend and suddenly I'm sweating. So it happens a lot in women who are menopausal women. Later on, we're going to hear about hot flashes and things like that. But what I'm talking about is I'm talking, for example, or I'm walking and suddenly I'm having this acute uneasiness. Something is not right. It's again Hashem's telling us that we should bring it up to a doctor and not say, as women, we tend to do a million things at the same time. We're taking care of the kids, of the house, we're making Shabbos dinner every week, the Chagim, we're buying clothes for everybody, etc. However, we could be like, "Oh, I'm exhausted and I'm having this pain now because I had a crazy week." So we tend to put excuses or to blame ourselves for whatever is happening. And what I'm trying to teach you tonight is please just bring up the simple fact to the physician. Don't say, "Oh yeah, it's probably nothing. It's probably anxiety, or it's probably because I had a crazy week, or I just married off my daughter. So obviously I'm going to be stressed." But it's not that. You need to say, "I'm feeling short of breath. I'm having stomach pain. I'm having chest pain. I'm feeling like my heart is jumping out of my chest." You need to say exactly what you're feeling and be proactive in doing the appropriate testing.
Absolutely. I couldn't agree more. I think to amplify that further, chest pain, of course, is going to be the number one sign. If you're having chest pain, that's a reason to go and get yourself taken care of. If it's crushing chest pain, if it's going down your left shoulder, you're feeling like you can't breathe, that's a moment to call 911. So we want to make sure that that's absolutely clear. There are also a lot of other symptoms, just to amplify a little further from what Dr. Rosanel was saying, that women can experience much more than men that might not seem classic, that trouble breathing with activity, trying to pick up the kids or the grandkids, and feeling more short of breath than you might otherwise, feeling dizzy when you're trying to do whatever it is you're trying to do in your life. That is something to definitely flag. Feeling your heart is racing or palpitations, maybe just feeling a sense of anxiety or a sense of doom. That is definitely something that we would want to hear about.
Yes, I
You
love
covered
that.
everything else, Dr. Rosanel.
that. I love that. So anxiety in the sense of doom, we tend to feel that us women, especially busy women, Baruch Hashem, we have a lot of children, we have a lot of things that we involve, and we tend to feel it, but we don't voice it. So please, please, please share that with us. We are here to listen to you. We are here to validate you. There is something called medical gaslighting, which is a famous term that came up in the past couple of years, and thank God. It's essentially the fact that you will do your due diligence. You are going to go to the doctor, but then the doctor is going to tell you, oh, it's nothing. It's just anxiety. Go home. Please, please, please make sure that you either go to somebody that you can trust and are going to do the testing. As a cardiologist, someone who's coming with palpitation or just telling me I'm feeling a sense of doom, like you said, like this anxiety feeling, I will always do a cardiac event monitor, which is a little sticker that's going to be by your chest area for 2 weeks. That's going to record the rhythm of your heart continuously. And that's going to tell me if and what is happening in your heart whenever you're having those symptoms. So without doing that, how can anyone tell you, you're fine, go home, you have nothing? So I'm huge into making sure that we listen to you and we do the right testing to prove or disprove whether you have something or not. And obviously, Hashem is in charge of the world, and Hashem put all those testing for us at our disposition. And this is our job as a shaliach to actually do what we're doing right now for you.
Wow, thank you so much. Those are really enlightening signs that we should be looking for. And so many of those are things that we can so easily brush off or, like you said, attribute to anything else going on in our lives. So thank you. And is there anything about aging, like perimenopause or menopause, that changes a woman's risk for heart issues?
Absolutely. It's, that's part of where we have that myth that women are less likely to have a heart attack than men. Because when we're younger and we have higher levels of estrogen, our risk for having a heart attack is lower. As we get older, though, especially once we get through menopause, then our risk of having a heart attack or a stroke, these are both similar related consequences, both go up and actually end up becoming a higher risk than amongst men because of the changes that happen with menopause in our hormones. So it's not that menopause itself is causing heart attacks. It's more that the change in what happens in our bodies and the many changes that then happen to how we might behave and the activities that we might do. The fatigue or the hot flashes might prevent a woman from being as active as she was before. There are changes that often happen related to weight that can around the menopause time, which can also then worsen certain risk factors for heart disease. So it's not to blame menopause in any way or to blame ourselves as women. It's not our fault. This is how Hashem made us, right? We are women and we're proud to be so. It's to understand that our risk for having a heart attack or a stroke changes from before menopause to after menopause. Dr. Rosanel, what do you want to add to that?
Yes, and I agree with everything you said. One thing also to remember is that the symptoms may be masked because they overlap with the symptoms of heart disease. So, for example, someone who has gaining weight and then they have swollen legs, they will not necessarily think, oh, the swollen legs could be a sign of heart disease. Well, it is. A swollen leg is a sign of possibly heart failure. So that's something that we also need to be very in tune with and make sure that we know about that. So important also to know, and that's why I keep on emphasizing to see a cardiologist from a young age in your 20s already, because you will get educated year after years and do a bunch of testing that we can do in your 20s, in your 30s, and in your 40s, etc., based on your risk profile and based on your risk factors. And therefore, when you reach the time of the menopause, which in general, heart attack increases as age increases, well, by that time already, you would have done so much work already on your heart and know the good things to do to prevent heart attack that you will not get it eventually. So there's so many tools that Hashem gave us, both from a medical standpoint and both from a lifestyle standpoint, that I'm a strong believer that if we implement all of them, if we know that vaping or smoking nicotine is 100% against the heart, but you know that from a young age, and you teach that to your children, then you will know that, to a point that I'm almost saying it's an avera to smoke, because by doing that, you're hurting your body. And then what's the point if you come see all the doctors and you do all the health stuff, but then you keep poisoning your body with these substances? And when I speak about smoking, nicotine, and vaping, I also speak about marijuana. So there's a big hype with in the world that marijuana is making you calmer. Yes, it does. That marijuana is used for cancer patients. Yes, it is. Or marijuana is used to calm your anxiety. However, every medicine has side effect and risk, and marijuana is actually directly linked to heart disease over the long term. So unlike cocaine, for example, which if somebody's experimenting with it, they will or may have a heart attack the day of the cocaine use. With marijuana, it's going to be over time. And that's something that hasn't been studied until recently, until the past 10 years now. So therefore, back then, we didn't know that marijuana was bad as well for the heart. So it's education, knowing that all of those things, marijuana, cocaine, all illicit drugs, vaping, and nicotine, those are bad for your heart. And you should not even get close to them. Make sure you teach that to your children. Make sure you teach that to your husbands. And that's something that I think is going to save life if people understand that concept of lifestyle modification.
Thank you so much. Before we touched upon some of the different things that we want to make sure that we have in our medical profile, you mentioned some lab tests and maybe an EKG or something to have a baseline. So what are these basic tests that every woman should ask her doctor about heart health? And at what age should we be looking for them?
That's a fantastic question. I think the other take-home message from tonight is going to be know your numbers. If we don't measure something, we can't do anything about it. And so some of it is just incredibly basic. What is your blood pressure? What are your cholesterol numbers? How many hours in a night are you sleeping? What is your weight? What is your, BMI or body mass index is important. It's not the only number, but what is your weight in the context of the rest of what is your blood sugar and how many minutes are you moving? So those are a lot of numbers that we can all get to know. And those are numbers we should know from when we're young, not to become obsessed about them, but to use them as guides to help us become the healthiest women that we can be so that we can live the healthiest lives that we can. And I say that very carefully because there is sometimes too much of a focus on just weight alone. And there is a healthy weight that we need to be at, and not too low, not too high. At different stages in our lives, that amount of weight that we want to make sure that we're carrying is going to change. Certainly, if you're in the years of pregnancy, that's going to look very different than in the years of menopause or in the later years of life. I would say in our preventive cardiology clinic, in people under the age of 40 who are healthy and well, we say come in every 5 years for routine labs. Let's check your cholesterol. Let's check your glucose or your sugar numbers in your blood, or that A1C that Dr. Rosanel mentioned, which is a summary number of what your blood sugar looks like over the last 3 months. Let's get your weight on record. Let's get your blood pressure on record. Let's maybe even do an EKG so we have that picture of what the electricity looks like in your heart as a baseline. And depending on what other history or other things that we learn about you, we might recommend other specific tests, but those are really the core of the prevention things that we do. How frequently we then measure beyond that really depends on an individual. It could be once a year, could be sometimes more frequently, and it could be every 5 years for somebody who's doing really well. Dr. Rosanel, what does your clinic look like?
So I love what you said about don't be obsessed with the number either, okay? Because I tend to see men or women who are becoming obsessed with exercising, okay? So we love exercising as physicians. What I mean by that, I mean the 30 minutes brisk walk every day. You can do more than that if you want on the walking side, but I'm not asking someone to run a marathon, okay? As a matter of fact, this is absolutely not what I want. Or when I say, for example, a little bit of weight training for men and women because it's good for the bones, I'm not asking them to lift 100 pounds. So it's very, very important to not develop an obsession about those numbers either. So same for the blood pressure. So some patients come to me and they say, oh, I check my blood pressure 5 times a day. No. That's absolutely not what I want. I want those numbers. It's giving me a guideline. It's a general idea. Like blood pressure has to be 120 the upper number and 80 the lower number. I don't want it above 130, but you will exercise and it's going to go to 160, and that's fine. You will be upset, and if someone takes your blood pressure with you, let's say you're coming to a doctor's office, you waited 2 hours, you just screamed at the whole planet there, and then someone is taking your blood pressure, obviously it's going to be high right now. So it's important to understand that those numbers are important for us clinicians and for you to have an idea about what's your weight should be, what your blood pressure should be, what the cholesterol, the good cholesterol and the bad cholesterol should be. But we should not be obsessing about them. Let the physician handle that obsession. So I always tell my patient, I tell them, I'm the one who should have the anxiety about it, not you. I got it, okay? I'm on top of your health. I'm making sure that the numbers are going to become the numbers I want based on what we're going to do together. But it's extremely important that we also have this mind over body and the stress reduction, hence the tefillah. The tefillah comes into play when you pray, when you daven to Hashem, whether you do Tehillim or whether you do just your own davening to Hashem. It's extremely important because this is a meditation that we all need every day. So it's like Hashem knew that today in the Goyish world, we say meditation is important to reduce the risk of heart disease and reduce stress and inflammation in general. But we've been doing that for years and for years and for years by 3 times a day, or for the men, or for us as much as we can, and talking to Hashem and making sure that we decrease the anxiety level, making sure that we have a good physician that we trust and let them handle that, okay? Be an advocate for yourself. So I'm huge into education. Hence, make sure the cholesterol is being checked, make sure the A1C is being checked, make sure your blood pressure is being checked. Make sure somebody's asking you about what are you eating every day? What's your food that you eat every day? Are you taking any nicotine or drugs? Make sure that someone is asking you about like you say, your sleeping pattern. If someone is telling me that they're waking up in the middle of the night, that's not normal. We don't want that. You're supposed to have continuous hours of sleep. So if you don't, something else is happening, okay? I'm just going to give you some example. I had young patients coming to the hospital because they were studying for an exam. So either they were taking for a law exam or medical school exam, and they were taking too many coffees in one day. They were taking energy drinks. So understand that this is dangerous and it will affect your heart, okay? So there's so much that we can speak about, because to become a cardiologist, it took me almost 17 years. But I speak about that all the time with all my patients, and I give them a little summary about the lifestyle, about what to do and what to avoid, and being aware that everything you're going to eat, how you're going to exercise, how you're going to manage your stress, how you're going to manage your work, people, they're working, or the kids, or this and that, all of that is going to affect your heart. And we have to know that it's important to trust Hashem, because the second you have the emunah to Hashem, you know that Hashem is in charge, no matter what. If Hashem wants Hashem Ishmael tomorrow for me to have something happen for the heart, it will happen. Now we're doing our ishtadlut, we're doing our work. We're making sure that we're eating properly. What it is to eat properly, okay? Making sure we have our fruits, we have our vegetables. I'm not asking my patient to take supplements. Every supplement is a medicine that is not necessarily FDA approved, but it's a medicine. And making sure that you know what you're ingesting. So fruits, vegetable, protein is important. What type of protein, and making sure that you stay in a normal weight. That's important. But again, not doing an obsession about the weight. So many people and women, we want to make sure that we look good, etc. Yes, it's important, but I want my patient to be healthy. That's really what I care about. So the weight, the no drugs, the alcohol. We didn't speak about alcohol. So we're allowed to have, let's say, 1 cup of wine on Shabbos and 1 cup of, on Friday night, and then Shabbos day. That's absolutely fine. But the heart is against becoming drunk, okay? Having 2 and 3 drinks the same day, you're not allowed to do that. So many times I ask my patient about how much alcohol they drink, and they say, Doc, I literally rarely never drink. The only time I will drink is going to be on Purim, for example, when I'm going to have, I'm going to be drinking to the point when I'm going to be drunk, but way, way, way drunk. So I'm like, okay, so you have to be very careful with that. It's okay to have 1 to 2 drink, but not being drunk. We don't like, the heart doesn't like it. There is some AFib, which is an arrhythmia that could develop from alcohol. And chronic alcohol use, meaning every day, multiple cups, that's not allowed either. So really the way the Jewish religion is done is really smart. So it's really meant to keep us healthy and alive for a long time.
Wow, thank you. Those were a lot of great insights, especially about how Yiddishkeit builds in, heart health to our religion. But I wanted to touch on one of these things that, Dr. Orkaby, I know you mentioned that under 40, you recommend that women come every 5 years or so. So, what age would you guys recommend that we get our first, let's say, baseline test with a cardiologist, or when should we see a cardiologist? And as well, would you recommend an earlier age for someone who has a family history of heart problems?
That's a great question. I want to clarify, it may not be possible for everybody to get in to see a cardiologist, and I don't know that that is necessarily the right choice for everybody. If there is a strong family history of heart disease, that would be somebody who would benefit from seeing a cardiologist on the younger side, especially if there's family history of early heart disease. So heart disease in a family member in their 30s or 40s, then certainly the children of those individuals or other family members should be seen very young. I think what is important for all of us is to have a primary care doctor who we can go to, who can check our numbers, and making sure that those numbers are actually being checked and assessed on some regular basis. I'd say a minimum of every 5 years for some people. It should be more, but that should really be a minimum for healthy people. And then if there is something that comes up, then referral to a cardiologist. But definitely seeing your primary care doctor on a regular basis is important. And I will say for those of us who are mothers, who are in those years, sometimes decades of having babies, we're doing everything we need to take care of our babies. And we might be going to see the OB regularly, but the OB is not going to do the things that a primary care doctor does. And so I remember turning around and saying, oh my gosh, it's been 10 years and I haven't seen my regular doctor. I've been seeing my OB. And so I had to make sure that I paused and actually got that on my calendar, because it's a completely different set of questions, set of lab tests that need to be done. And those are just as important as taking care of our kids, right? Going back to that same principle, if we don't take care of ourselves, we can't be there for the rest of our family members.
Thank you. Dr. Rosanel, is there anything you'd like to add to that?
Yeah, so I love what you said, because so many times I have young women who are our age, because we are both of us, or the three of us have a young woman as well. And they come to me and they said, Baruch Hashem, I have 1 kid, 2 kids, 3 kids, 4 kids, etc. And I have an OB that I see every year, but I don't have a primary care physician. I don't have an internist that I go to, and let alone I don't have a cardiologist. So extremely, extremely, extremely important to have a physician on, not just your OB, okay? So we're talking about your primary, as a kids, we all had a pediatrician. Our parents brought us there. We had to do everything we had to do, but then life takes over and we go, we get married, etc. And then we see the doctor, which is the OBGYN, and we forget that there's much more to see than just an OBGYN. So it's extremely important. I'm personally, to become a cardiologist, you have to be an internist first. So all of us are trained as internists, internal medicine doctor, and cardiologists. I currently practice as both internal medicine and cardiology. So I love to see young patients because I catch them right away. I see the cholesterol creeping up already. There's also something I didn't mention. It's called the lipoprotein A, which is called LP, little a. And this is a new test that came up in the last 5 to 10 years. And it's a blood test that I do to every single one of my patients that comes to me. And it gives me an indication. It's a once in your lifetime test. You don't have to repeat it ever, ever, ever. It's not like an A1C that I mentioned earlier for the diabetes. It's not like the cholesterol that fluctuates every day. It's lipoprotein A that tells me if the patient has the risk of heart disease. It's a kind of a gene. We call it, like, let's say, do you have the LPA that's high? And if it's high, then it's a whole different ball game. And you could look healthy. You can be a skinny, healthy, young, exercising and eating right, and you name it, and have everything perfect, including a perfect blood pressure and a perfect this and a perfect that, and yet be at the risk of heart disease for the long term. And I just want to say something. We start accumulating plaques, which are essentially a buildup in your arteries. So I'm just going to show you my little cute hearts. Okay, so this is the hearts, just so you know. Those are the arteries in red all around the heart. Each of them have a specific name, okay? So each of them is extremely important. Those red artery are called the coronary artery. They are responsible for heart disease. This is for heart attack. What it means, if somebody has a cutoff, okay, a heart attack, meaning a plaque that's going to disrupt and creates a clot and cut off the blood flow that's going, let's say, in this actual artery, what's going to happen is that the heart is going to stop pumping and stop doing its job, and that is called a heart attack, okay? We start developing plaques at the age of 12 years old, okay? And over time, it's going to build up and build up and build up and build up. That's why we see people dying of a heart attack later on in life. But again, prevention, education. If we know that my LPA, let's say, if I know that my LPA is high, then what do I do? What's next? Okay. Then there is multiple testing coming along, such as a calcium score. What's a calcium score? It's actually a CAT scan that you go into the machine in and out. And it tells me, it gives the tools to the cardiologist to know if we need to start this patient on baby aspirin or on a statin, which is like a Crestor or something like that. Those are strong medicine. I'm not going to deny that. I'm not going to tell you it's nothing. But what's better? That someone dies from a heart attack in their 40s, not knowing that they could have prevented that if they would have started aspirin and statin from a young age, or not. So, by the way, that's a question that even us, the cardiology community, always ask ourselves. We go to conferences multiple times a year. We do research constantly, and we have to stay on top of our own education to be able to give those answers to you. And I always say in a very humble way to my patient that whatever I'm saying today is not necessarily what I'm going to tell you at next visit, because medicine is an evolving field, and I know that back in the days, for example, we used to say aspirin is protective for everybody. Everyone should be on aspirin. That's going to save you. But then we change our mind. We're like, never mind. We're only going to give it to the diabetic patient. So no medicine is free, okay, free of side effect. Everything has a risk and benefit that we have to weigh at all time. But again, having this trusting relationship early on, the same way you trust your OBGYN to have the beautiful babies and to know that you're going to give birth and you're going to be fine, you need to have the trusting physician, either internal medicine, primary care physician, or cardiologist that hold your hand throughout your life.
Thank you. I'm looking at the time, and at around 8:45, we're going to start leaving time for questions from the crowd, which ironically, Dr. Rosanel, you just hit on one of the questions. Someone was asking about the apolipoprotein. So thank you for addressing that unprompted. So if a woman in our community wants to start protecting her heart today and wants to do something small, concrete that she could really fit into her busy schedule, what example would you give and what advice would you give to the women here?
That's a great question. I think it has to be very personalized for every woman. It depends on where we're starting from. But I think, again, sort of echoing what we've been saying up until now is get that one-time visit, at least once. Make sure you know your numbers, know your blood pressure, know your cholesterol, know your sugar levels. Maybe even get that lipoprotein(a) checked. I don't know that we're saying that everybody should have it done yet, but perhaps that is where we're going to be going pretty soon. And all the other numbers that we were talking about. And then pick one, whichever one needs to be addressed, and make that change. Sometimes the easiest one is actually movement. So many times we think we're moving around all the time. We're running after the kids. I can't tell you how many times I've driven carpool for hours and hours on a Sunday, and then suddenly I look at my phone and realize I've only have 2,000 steps in the day. So I need to get up and go for a walk. And I just did that tonight after dinner. I said to my kids, all right, guys, we finished dinner, we cleaned up, let's go for a walk around the block for 20 minutes. And make it a family event, do something together so it doesn't feel like it's just a burden, but movement, regular movement. If I had to pick one thing, that would probably be it. Because when we move regularly, it helps lower our blood pressure, it lowers our cholesterol, it improves our mood. It does all the things that we need to make us feel better. And we say that we have to run to do our mitzvahs, right? So I'm not sure that we all need to start running, but at the very least, we should start walking and making sure that we're doing what we can to take care of ourselves. But again, with that caveat that every woman needs something a little bit different. So it could be that for some women, it's really focusing on taking the blood pressure medication that's been prescribed and trying not to forget it, or making adjustments with diet and thinking about what are we cooking for dinner? Is it going to be ordering out again with a high salt content, or is there something that we can do to try to make something at home that's hard? that's not necessarily something easy for every woman to do, especially if there is a big family or if you're working. I think all of us here can definitely understand that. It's really hard to make those healthy choices when just getting chicken nuggets out of the freezer sometimes is the easiest way to go. How do we balance that with the fruits and vegetables and the healthy, lean proteins that we want to make sure that our family has every day?
And Dr. Rosanel, what would you suggest is a cornerstone habit that can be easily fitted to someone's daily life?
Okay, so like I said, the nose first. No smoking, no vaping, no drugs. Okay, so that's important. If you're taking caffeine, coffee, you can have one a day, not two and three the same day. Exception, you can have a second coffee. I just had a second coffee today.
I was going to say, I'm not sure I could follow that rule, Dr. Rosanel. I think I need my 2 cups a day.
Right, because I
But
had
you're
to
right,
do that.
moderation.
But you try to take let's say one espresso shot a day. You monitor the caffeine intake. That's important. No energy drink. I am against them. I'm also not for the sugary drinks in general. So that's important. Controlling your making sure you know your blood pressure without doing an obsession about it. Making sure you do your blood tests. That's extremely important, but know what blood test you got. Make sure you listen to your body, okay? Be in tune with who you are, with what's bothering you, any ache and pain and anything that's gonna make you think, oh, what's going on? My arm hurts, or my chest hurts, or my stomach hurts, or I'm being swollen today in my lower extremities. Bring it up to somebody's attention. It's a sign that Hashem is giving you, and I'm very big into listening into the signs that are being given to you. And other than that, have a trusting physician that you should go see at least once a year. That's very important.
Thank you. I'll end with one more question before we move over to the Q&A. So again, if anyone has any more questions percolating, please feel free to write it and so we can try to address as many as possible. But one last question is, what's one myth about heart disease that you would love to erase forever?
That it can't happen to you. It can happen to anyone. And we just need to be aware. We need to listen to our bodies. We need to listen to the other women around us and make sure that we realize that we're at risk too, and we have to take care of ourselves.
Yeah.
And Dr. Rosanel?
So I love what you said. Very important. It happens to men and women. It could happen at any age, even though it's happening usually as we're getting older. But very important to know that we should take care of ourselves by seeing a physician and by doing the appropriate testing that we have to do. There's a lot of misinformation on social media or around, like your friend is starting this new medicine, swearing by this new supplement. Don't fall into it, okay? So all the new meds and the new things, you need to speak about it with a trusting physician. Okay, so that's really, really the one takeaway message that I would say is make sure that you do your own research. The same way you have a trusting rabbi, right? We don't trust any random rabbis. We each have our own trusting rabbi, leader of our community that we refer to for questions. You should do the same thing for physician when it comes to your medical health. Okay, don't listen to everyone and everything. It has to be from a trusting source.
Thank you. So now we're going to transition over to questions from the crowd. So one of the first questions that came in was actually a question about taking different supplements, in particular aspirin and statins. That those seem to be things that, aspirin, like you mentioned, Dr. Rosanel, is something that used to be recommended very heavily. And now it does seem like a lot of people have been taking statins, whether that's just, word of mouth, that people seem to be taking a lot of it. So do you think that's something that everyone should be on?
Okay, so there's two questions to that question. Supplements is really, let's say, vitamin D, vitamin C, or like folic acid, or like some concocted turmeric, whatever it is, okay? So a lot of people, they will buy pills of like turmeric or pills of beetroot or something like that. So I tell them, I want you to have varied diet, which is full of all vegetables and all fruit, so that you'll get all the vitamins from them, okay? That's the number one question when it comes to supplement. I said, everything is in the food that Hashem gave us. Non-processed food from the earth. This is beautiful. Do it this way. Now, if we're talking about medicine, medications prescribed by your physician, that's a whole different ball game, okay? If I'm prescribing a baby aspirin 81 milligram versus the 325, which is something for the strokes, that's not what I'm talking about. I'm talking about a small dose. And if getting to the point when I have to give a Crestor or a statin to my patient, I don't want to do that, honestly. That's not something that I'm aiming for. It's my last resort. We're going to try first the diet and exercise, the lifestyle changes, etc., etc. However, if we're doing everything we can, and I know your father died from a heart attack when he was 45, and I know that you have the lipoprotein A that's really high, and I know that we did a calcium score or even a CTA coronary, which is a CAT scan of your heart with contrast and radiation, and it shows that you already have 55 to 60% of plaques. And just so you know, again, I'm taking my beautiful heart. If you have over 75% of plaque, when we do a CTA coronary or when we do an angiogram, you need to have a stent. A stent is a little tube that stays inside the artery and leaves it open. Now that you understood kind of the puzzle or the problem that I'm facing now, if I'm telling you that Hashem gave me all the testing and all the evidence for you to be on the aspirin and the statin to try to prevent the plaque from getting bigger and thicker and obstructing the artery and killing you, then you have no choice than to take it. If you don't take it, then you're doing an error because you're going to end up dead. Okay? But again, I've done my due diligence. I've done my work. I've done all the testing and I've taken care of you for years or for months before I came to that conclusion. And therefore, my patient take the medicine, even those who hate it, because we trust each other. I understand that this is not ideal. I wish I would not have to prescribe you a statin, but if I'm doing it, it's because we have no choice.
Yeah. What I would add to that is it really depends on what your risk is. I think that's just to amplify what Dr. Rosanel is saying. Aspirin, our understanding of the need for using aspirin has really changed in the last decade. And so if we go back to 1980s when some of the first trials, the first research was really being done rigorously on aspirin, that was also a time where we didn't have other drugs like statins, where a lot of people were still smoking and drinking alcohol at much higher levels than today. Overall risk of having a heart attack was very different than it is today. We've also learned, exactly as Dr. Rosanel said, that there are risks and benefits to everything. So taking aspirin can, in the right high-risk patient, help lower the risk of having a heart attack, but it can also cause bleeding. And so that's a risk that we need to be very careful with. So I would not recommend that people listening tonight just run out and go and take an aspirin every day. That may not be the right choice for you. But if you're worried, you want to know more, definitely ask your doctor. When it comes to statins, I think we've learned a lot over the last few decades about who will benefit most. And for people who have not yet had a heart attack or stroke, it really depends again on your risk. And so that's where those new tests, like Dr. Rosanel was saying, really come in very handy. And there are some other things that women here should also be aware of. And that is, I don't think we got to talk about this today, but what was your pregnancy health like? So if you had gestational diabetes or preeclampsia or other things that might not be what we consider traditional risk factors for heart disease, like high cholesterol or high blood pressure, but if you had those other things, you might be somebody who would benefit from taking a preventive medication like a statin. So talk to your doctor. It could be that that is something that's right for you.
So I love what you say, and I'm just going to add two more risk factors that are not common that people don't think about. Autoimmune disease, okay?
Yeah, which is common in Ashkenazi community.
Men, we have autoimmune disease from a very young age compared to men, and those are risk factors for heart disease that people forget about them. Chronic kidney disease, okay? Anybody who had a kidney transplant or kidney problem, those also are a risk factor for heart disease that are very frequently overlooked, okay? So that's important. All those things are little things that are important, but unless you have, again, that relationship with the doctor when you can have the time to discuss all of that and to know all of that and to know your patient, the doctors, us, should know you guys very well, then we can make an informed decision and not miss some things.
Yeah.
Thank you.
But I just don't want anybody to go home tonight and say, we need to start all these pills. Might be right, but talk to your doctor. Go get that visit.
Thank you. That was very comprehensive and very enlightening. I think one of the themes that we touched a lot on tonight was having a primary care provider who you can trust and you go to and you make sure to see on a regular basis. So what are some of those signs of a good physician? Especially we live in a time where physicians are rushed with all their visits. So how do we know that the doctor we're seeing is one that we can trust and is making sure to do all the right things and ask us the right questions. And one example that someone specifically asked is it normal for a primary care physician not to do blood tests annually unless a specific reason comes up? So if you could please address that.
Yeah. I'll speak from the primary care prevention side, and then I'll let Dr. Rosanel speak from the cardiology side specifically. If you're healthy and well, you may not need blood tests more than every 5 years. And that is something, at least up until the age of 40. So between graduating from your pediatrician, when somebody goes off, leaves the house, goes off to seminary, goes to school, whatever it might be, until you're 40, going every 5 years, if everything looks good and the numbers are all normal, you may not need to have blood work more often than that. On the other hand, if you're seeing somebody who's not checking your numbers or brushing them off or saying, oh, your blood pressure is 130/80, that's fine. It's not. It should be lower, especially if you're otherwise healthy and well and young. That is exactly the right time of life where you want to make sure that your blood pressure is well controlled and your other numbers. So it's really about, again, finding the right person who's going to make sure that they're measuring what they need to measure at the right time. And more importantly, even than that, following it up so that if something comes up and it's not within normal or it's elevated or you're worried about it, that they're listening to you and coming up with a plan.
So from my perspective, I don't know if you heard at the beginning of the presentation, I used to work in a hospital, and I used to be an attending in a hospital from internal medicine's perspective, and then an attending for cardiology perspective. There's something that patients have to understand is that when we're working in a hospital and we have quotas that we need to see, for example, in my case, I had to see, let's say 20 cardiac cases on a regular clinic day. So clinic day will be running from like 8 o'clock until about, I don't know, 3, 4 o'clock. And then on the days that I was working in the hospital for the clinic, not for the clinic, but for the cardiology consult in the hospital, then it could be any number of patients that I had to see, anywhere from 20, 30, 40, 50 patients in one day. So whenever you're going to see a doctor, whether you're seeing a doctor from an emergency room setting or hospital setting, or whether you're seeing a patient from a clinic setting, understand that unfortunately they don't have a lot of time allocated, or if they do, then at least be on, the doctor should be, okay, we have, let's say 15 minutes, 30 minutes, 45 minutes. It depends on the structure of each hospital. That's number one. Number two, the patient should know that they come first, always. To us, to our eyes, to the doctors, patients come first. Patient safety comes first. Therefore, if you feel rushed, then take your time, speak to the doctor, have a list of questions, come prepare and say, doctor, I would like to address this, that, and go over all the questions. So make sure your doctor listens to you. Make sure your doctor do a physical exam on you, listen to your heart or your lungs. Make sure that the doctor, if there's anything that you complained about, any red flags or any sign that Hashem gave you, you communicated with them, something must happen. A blood test, further testing. Don't let anyone just brush it off. So that's important. Have a regular follow-up with your doctor. So let's say you're going to see someone who works in the hospital system. They only can give you 15 minutes for follow-up. That's fine, but make sure you have more follow-up coming up so that at least all your questions are going to be answered appropriately as the time go by. So in my perspective, from my end, I was working in the hospital for many years, and then I branched off and decided to do this private concierge system because I love to spend time with the patient. I can spend an hour and a half with the same patient consecutively without touching my phone. Just now, we've been together for 55 minutes. Imagine a one-on-one situation with me for an hour and a half until we go over everything. And I see my patient once a month, whether they want to see me or not, because I want to make sure that they're doing good and we discuss everything. So it's not in my situation, I am an internal medicine doctor and a cardiologist, and I practice both. So I have two specialties that I'm practicing right now. Back then, I used to only be an internist, and then I used to only be a cardiologist. So anytime someone would come to me as their cardiologist only, I would say, okay, I'm noticing that you have a lump right here in your throat, around your throat, in your neck, something thyroid related. I'm just letting you know to please bring it up to your primary care physician's attention. Or I'm letting you know to bring it up to your internist. I used to do that when I was just a cardiologist, but because I'm both today, I'm handling both of them and I'm tackling both of them. It's a very unique situation that I'm in. It's not necessarily what every cardiologist is in, and even myself, I wasn't at some point. So understand that we need to listen to you. I think that's the most important part, and act about it.
Thank you. There are two more questions that I really want to try to get to. So let's see, Dr. Orkaby and Dr. Rosanel, either you can choose to answer both or just one, but try to keep it brief so we can just get to both of them. Can you please comment upon the risk of COVID and how that affects, comment on COVID and how that affects the risk for cardiovascular disease?
I think very briefly, COVID can increase the risk of a cardiovascular event. The highest risk is when somebody is acutely infected. I will say that the risk was higher in 2020 than it is now. Most of the world has been exposed to COVID, and many of us have also had vaccines. So the risk now is lower than it was. But as with any other viral infection, whether it's flu or anything else, there is an associated risk of also having some kind of heart attack.
So yes, absolutely. Again, we could spend hours on COVID. Okay. Back then, I was actually a cardiology fellow when COVID happened in Maimonides, in the epicenter of COVID at the time in March 2020. So yes, we did see COVID having an increased risk of clots in the heart, causing heart attack, clots in the lungs, and clots in the legs. Lungs would be pulmonary embolism. Legs would be a GVT, which is deep vein thrombosis, and definitely we had young patients that had no risk factor whatsoever. And then we saw multiple clots everywhere in multiple arteries. So back then, like Dr. Orkaby said, COVID virus from 2020 was a different virus that we have today. It mutated over the years. Thank God today we're okay. But yes, 100%, we did see some increase of heart attack with COVID.
Thank you. And I believe that's the last question we will have time for. Is just one more. So this question is, what can we do preventively for plaque buildup?
Okay.
Know your numbers and take your statin if you're prescribed it. I think
So
that.
plaque buildup, like I said, happens from the age of 12 years old to almost all of us. Not all of us are going to die from heart attack, but it will build over time. That is fine. This is not the end of the world. It becomes a problem when the plaque is unstable, and it becomes a problem when the plaque takes over the whole artery. So one way to prevent us from having a heart attack is to go see a doctor, understand what are your risks, and take the medicine if needed. And again, this is what I'm saying today. I may say something completely different in a couple of years, or even at the end of this year, because we always trying to improve ourselves and to make sure that we're doing it in a safety way for our patients.